Hi, this is Francisca on Health Matters. Now, one of the essence of having this platform is to talk about medically related topics in such a way that is relatable to you, my viewers. Now, today I'm going to be discussing Alzheimer's dementia. Alzheimer's is a highly prevalent condition, right? Affecting typically the those in the elderly community, the older people. So people from 65 years and older are typically affected by this condition, right? Now, there are other forms of dementia. This, however, is the commonest, accounting for about 80%. And here in the United States, it's said that about 5 to 6 million are affected by this condition, right? What are the other forms of dementia? There's what we call Lewy body dementia. There is frontotemporal dementia, there's vascular dementia, normal pressure hydrocephalus, progressive supranuclear palsy. These are all conditions that present with dementia. However, there are certain distinct features, about each of these conditions. Alzheimer's having its own unique feature, and we're going to unload here some of the unique features and other presentations of Alzheimer's. Now, it is important to note also, apart from the dementias, there are other conditions that could present with memory loss, and confusion, disorientation, and a typical example is delirium. Now, unlike dementia, delirium is sudden in onset. There is the presentation of confusion in the patients and disorientation. There could even be associated mood changes, personality changes, hallucinations, changes in sleep patterns. But like I said, this is sudden, and most times there is a traceable causal factor. Metabolism, there could be infection that could have triggered this, drugs, medications, either withdrawal or intoxication, right? So there are several factors that could bring about delirium. Now, as just as much as it has the sudden onset, when the problems are identified and addressed, it also can be easily waned off, right? The manifestation, that is. The various authorities have defined or identified the various stages persons affected by Alzheimer's go through. Before that, let's talk about the diagnosis. So in diagnosing Alzheimer's dementia, typically they're not going to come by themselves. They're going to be accompanied by a caregiver or family member who really have picked up certain symptoms that are unusual, especially that of memory losses and certain behavioral changes, or not doing things, habits that were typically done by them, right? So they come to the provider, and there's that extensive history taken and physical examination, right, and cognitive assessment, right? Investigations done, blood work going to be done. The blood work will actually exclude other possible causes of memory losses, because the key presentation of dementia is memory loss, right? And also that cognitive decline that manifests in different ways, maybe problem solving, being unable to perform certain tasks in a successful manner, right? But the emphasis on memory loss and changes in behavior in such a way that it has started to affect their daily livelihood, right? Their daily lifestyle, and they become dependent on the family members or caregivers. So there's a history taken. I've talked about the history taken, the physical examination, especially the cognitive assessment, the neurocognitive assessments, and then investigations. Investigations will include blood work and imaging, heavy emphasis on imaging investigations. For the blood work, first of all, there are many issues that could, or many conditions that could present with memory losses. So there's a need to actually exclude these other conditions, these other investigations. There's need to assess the thyroid levels. There is B12 deficiency, which is also common in the elderly community. There is the decrease in food intake, and they tend to lack essential nutrients, vitamin B12 being one of them. Now, also depending on certain history, previous history, there are certain STDs, for instance, that over time as a late complication could manifest with memory loss. Example is syphilis. And so those are tests that will be exclusively done depending on the history. Now there's heavy emphasis on brain imaging. So we have tests like the computerized tomography, CT scan, and the magnetic resonance imaging, MRI of the brain. For Alzheimer's, there's the presence of what we call amyloid plaques and neurofibrillary tangles, right? And these are the hallmark for diagnosing Alzheimer's disease because as against other dementias, they are not present in well before the manifesting of forgetfulness and other symptoms associated with Alzheimer's disease. These have already started to form, right? And they are what ultimately will cause the manifestation of symptoms of forgetfulness, because these plaques and proteins, abnormal proteins, they start to accumulate within the nerve cells and cause shrinkage. And initially they might involve a certain part of the brain, but over time it becomes extensive. And during that period of extensive inclusion of brain tissue, patients start to exhibit symptoms of forgetfulness and other symptoms that accompany Alzheimer's dementia, right? So that is a hallmark for diagnosis, and heavy emphasis is placed in these tools in making the diagnosis of Alzheimer's dementia. Now, there also are the biomarkers that could be present. This technology is still ongoing, but there is high expectation that with the presence of biomarkers being seen, this could actually help to diagnose the condition early, much early, and hence have an early intervention, right? So these are the typical diagnoses. I also mentioned the emphasis on cognitive assessment. So for cognitive assessment, there are various tools that help to assess the cognitive functioning. They help to denote the person's ability to recall, and then also that orientation, attention span is also seen or assessed during this cognitive functioning test. So these help in diagnosing the conditions of Alzheimer's dementia. So talking about the manifestation of Alzheimer's dementia, how does this manifest? Various authorities have various ways of categorizing the progressive decline in Alzheimer's dementia. There are some authorities that will talk about mild stage, the mid stage, or the late stage, right? There is some categories or authorities that put it in 5 to 6 stages, and there's one in particular I'm going to talk about, right? Now, in this category, there are 5 stages, right? I did mention the stage of the presence of plaques, presence of amyloid plaques or neurofibrillary tangles that are forming in the brain. However, there is no manifesting of the symptoms associated with Alzheimer's disease condition. It's called the preclinical stage. There's the presence of the plaques and amyloid plaques and the protein tangles that accumulate, right? And these take years to form, right, before the manifesting of the condition. Now the second stage is, so this is the first stage is called the preclinical stage. Then the second stage is mild cognitive impairment. At the mild cognitive impairment, the person starts to have memory losses and even inability to think effectively or efficiently. However, at this stage, the impact on daily livelihood hasn't started to occur, right? They're still pretty much carrying out normal functioning or going on with their normal activity, right? They're able to work. They still are able to maintain relationships with family and friends, right? But there's that onset of the issues with forgetfulness and thinking. And there is one aspect of short-term memory. They are able to remember things that happened years ago, 20 years ago, 30 years ago, but something that happened yesterday, I literally mean yesterday, something that has just recently occurred. They might have problems in really talking about these events, right? And this is very typical. The one aspect that is affected initially is what we call the hippocampus of the brain, and this is the part of the brain that has to do with short-term memory, right? So there is the manifesting of events around recent events, being unable to recall these events, right? So that's the mild cognitive impairment stage. Now, the third stage, which is the mild dementia stage. Now, this is pretty much the stage at which family members and loved ones actually pick on this diagnosis, even the doctors when they present, because there is a significant memory loss and ability to think and even execute functions where the diagnosis is typically made. So here they become dependent on people for just carrying out, to be able to carry out their normal activity, right? Even activities such as grooming, personal grooming, right? They're still pretty much able to communicate. However, there is very marked impairment in that communication, right? There is problems with problem solving, communication, judgments, making sound judgments, and all that. This becomes highly impacted at this stage. Now, going on to the fourth stage, which is the stage of moderate dementia. Here, the impact is there's marked confusion, and certain functions of the body are beginning to get affected. There could be the effect on the bowel and bladder control, right? So they tend to lose control of these reflexes associated with these functions, right? And like I mentioned, there's marked confusion here, and here they are highly dependent on caregiver, right? The family members, right? And this case, it's really worsened at this stage. And then there's the fifth stage, and here there's even further decline in mental capacity, physical ability, apart from the typical issues with memory, personality changes here. There is inability to even be physically active. The muscles become rigid, right? They are highly dependent on the caregivers for even movement, basic living, right? So this is the later stage of Alzheimer's dementia. At this stage, pretty much they might be in the hospice care. There's problems with swallowing. They could easily aspirate food or liquid and develop pneumonia, and they could die from aspiration, right? There's also prone to infection or fall or dehydration. Problems that could arise at the late stage that ultimately could lead to the death of this patient. So that's a quick summary of the stages. Let's talk about the management. So talking about the management for Alzheimer's, maintaining a healthy lifestyle, continuous involvement in healthy physical activity, exercise via exercise, doing pretty much 30 minutes of exercise daily, involvement in activities that stimulate the mental or intellectual intellectual being. So involvement in games such as word puzzle, chess, etc., to pretty much stimulate the brain. There's emphasis on maintaining a healthy lifestyle by taking balanced diets, right? Taking good foods rich in that will provide all the basic nutrients. There are also medicines that are given to these medicines they help to control the symptoms. They don't revert symptoms, they don't cause a cure, but for now the emphasis is on giving medicines that control symptoms. The majority of these medicines actually help to maintain a good level of what you call acetylcholine, which is main neurotransmitter in the brain that helps with the transmission of signals. There are also drugs that are given to help to modulate mood, right? Because mood changes one aspect that is common with people that have Alzheimer's disease. So there are medicines that could attend to that. And then in general, The caregiver too, there are supports given to both patients with Alzheimer's and the caregiver, because if you think about it, the caregiver is in the center position, right? Be it a family member, a friend, or loved one, right? There is a burden on the caregiver, and so emphasis too to provide the caregiver with resources that could help to, maintain that normal um, livelihood, even though it is pretty much affected. Um, there are resources provided by Alzheimer's Association that could help to just help to control the condition, and the experiences that are observed by both the caregiver and the persons affected by Alzheimer's, right? Towards the end, I did mention there's issues with swallowing, right? So this becomes another significant aspect in the management. There might be the referral to a speech therapist that will help to control that issue. Food will be given by, hand. The patient is advised to be hand fed. There might be the discussion with having tubes. However, at times patients are known to, unplug the tubes, and that discussion is meant to be with the primary care. So um, it is a multidisciplinary approach when it comes to the management of Alzheimer's, but that is typically the summary, right, of the management of Alzheimer's. So like I said, this was meant to be a brief discussion. There's so much to unravel and unload when talking about Alzheimer's. But I hope this short discuss is enough to have just a concise idea of what the issues around Alzheimer's, including the management, entails. So I hope you have found meaning to this discussion. I'd like you to like and subscribe, and I'll see you in the next one.